I think it's important to understand that the Affordable Care Act has had a dramatic effect on Cook County. You know, the Affordable Care Act has lots of moving parts. One part is Medicaid expansion, and that's the part that has been so critical to the residents of Cook County and to our health and hospital system. What it's meant is that those who are 19 to 64 years old get the same kind of federal support for their health care as those of us 65 and older do through Medicare. You know, President Obama gets a lot of criticism for the Affordable Care Act, but let me tell you, this part of it is working extremely well. It's been a real boon to the individuals in Cook County who are only sporadically or intermittently covered with health care, and also to the county taxpayers, because it's meant a substantial reduction in our local contribution to support our health care system as the federal government has picked up its support. You know, our health and hospital system is more than 100 years old, and we have always served those who needed care and who did not have the financial resources to pay for it for themselves. And we've also served anybody who came in the door regardless of their citizenship status. So we have a very distinguished history of serving anyone who comes to us. And that's something of which I'm very proud, and I know that those who work in our healthcare system are very proud of it as well. However, the facilities in which we provided that care have not always been first rate, and we are now moving into an environment where we are not simply a provider of last resort, but we have to be a provider of choice. And we have to provide the first-rate care that we provide in a first-rate facility. The beautiful new facility that we're building on the Stroger campus will be 9 stories, and half of the space will be devoted to primary care, specialty care, and the other half will be devoted to office space for our docs and administrators of our hospital system. It's going to be a beautiful addition to the Illinois Medical District. Separate and apart from our work on a new health center, we've also engaged a consortium of folks to redevelop the old Cook County Hospital, which has been abandoned for more than a decade. It was closed down when the Stroger Hospital was opened, and it has been an albatross in the Illinois Medical District ever since. The old Cook County Hospital will be renovated by a private development team. The county has made a modest commitment to be helpful there, but almost all of the costs will be borne by the private development team. We hope to see this building redeveloped as hotels and office space, and it'll be the first phase of a multi-phase development that will include more office space and residential development and will transform the near west side of Chicago. When I was first elected, I was visited by Thresholds, a not-for-profit organization that serves that population, and they said on any given day, 1/4 to 1/3 of our jail population struggled with mental illness, often with a dual diagnosis, mental illness and substance abuse. So when we put together our Medicaid expansion plan, we included behavioral health services, and that's been an important emphasis for us as we've built out our Medicaid expansion program, County Care. In addition to which, we've worked with the Chicago Police Department and set up a triage center, the community triage center in the Roseland community, where police officers can bring people who are clearly in crisis, who are in the throes of addiction or who are acting out as a result of their mental illness, bring them there rather than taking them to our jail or taking them into the emergency room at Stroger Hospital. So this community triage center, which is the first of its kind in the county, was opened last fall, and we hope to ramp that facility up and perhaps to have them elsewhere in the county to respond to demand. And we know that there's a great need for behavioral health services in the county. I'm very grateful to Dr. Shannon and his team, his leadership team at the health and hospital system for their good work day in and day out. Healthcare is one of our 2 critical missions in the county, public health and public safety, and we're indebted to them for the good care that they provide to our patients each and every day.